Hello. Today we're going to talk about the trust strategy for addressing the ongoing misuse of opioid prescriptions within British Columbia. In Canada, 8.2% of opioid misuse occurs within British Columbia, resulting in approximately 7,000 deaths per year. Our program has three pillars: trust, review, and stigma, as part of its strategy to help address the ongoing crisis. Our first pillar is trust. It's focused on rebuilding and reinforcing the doctor patient relationship through engaging the patient in the treatment process. The objective is to increase trust and improve health outcomes with longer success.
Our second pillar is going to analyze the existing societal frameworks surrounding opioid use by looking at how opioids have been marketed to doctors historically and alternative treatment methodologies that do not rely on the use of opioids. The primary outcome of which is to figure out how we can move forward without opioid use. Our third pillar has three primary objectives, the first of which is to expand local support systems, the second of which is to update school curriculum to better educate students, and third is to shift the language to more humanize those who struggle with opioids, ultimately making it easier to seek out help.
To enhance patient health outcomes, rebuilding the lost trust between doctors and patients is a key first step. The trust strategies will employ a new approach that focuses on rebuilding that relationship and engaging the patient more throughout the care process. The keystone of this will be the application of SMART goal strategies. Studies have shown that engaging patients with these strategies have led to greater success rates than traditional treatment strategies. Trust will also work on reviewing the state of opioids, producing guidance on how legislation surrounding penalties associated with drug use can be changed to better serve the recovery of Canadians and youth. Additionally, to address the concerns surrounding the marketing of opiates to doctors and consumers, key points for a code of marketing will be collected which can be enforced.
And finally, as part of the review process, we will also analyze the steps that have been taken by doctors to manage the risks around prescription opioids and highlight the potential shortcomings in these steps. Additionally, we will explore alternatives for treating pain outside of the use of opioids, especially for chronic or long-term pain. And the final pillar of trust is to break down the stigma surrounding the opioid misuse. And the first step to do this is to change the way students are educated within British Columbia to allow them to be a stronger peer support network. This would primarily include the addition of compulsory first aid training as a required component for high school diplomas, and this training would include the use of naloxone. As part of this, the language surrounding drug use would be shifted to humanize those who struggle with drug dependencies and ultimately be more compassionate.